Now, drug therapy of migraine. Migraine is a mysterious disorder characterized by pulsating headache, usually restricted to one side, and which comes in attacks lasting 4 to 40 hours and is often associated with the nausea, vomiting, sensitivity to light and sound, flashes of light, vertigo, loose motion, and other symptoms. Two major types are migraine with aura. Classical migraine is which headache is pierced by visual or other neurological symptoms, and migraine without aura, common migraine, pulsatile dilatation of uh, certain large cranial vessels is the immediate causing of the pain, and the pathogenic mechanism are not well understand. And the vascular theory uh, holds that initial vasoconstriction or shunting of blood through carotid arteriovenous and anastomosis produce cerebral ischemia and starts the attacks. The neurogenic therapy considered it to be spreading, dispersing of cortical electrical activity. Now, charges in the blood, urinary levels of the 5-HT and its metabolites during a migraine attack. Its precipitation by 5-HT release and efficacy of drugs having action in the sternonergic system to prevent, abort, and terminate migraine and attacks suggest is pivotal role of a 5-HT in this disorder. Drug therapy of migraine has been divided individuals analyze severity and frequency of the attack and the response of an individual patient to drug uses earlier determine the choice. The strategy mostly adopted is summarized in the box. Mild migraine causes having a fever than one attack per month of throbbing but tolerable and tolerable aching headache and lasting up to the 8 hours, which does not incapacitate the individual, may be classified as a mild migraine. And simple analgesics like paracetamol 0.5 to 1 gram or aspirin 30 to 60 milligram taken at the first indications of an attack and repeated 4 to 6 hourly about and suppress most mild attacks. Non-steroidal anti-inflammatory drugs are their combination. Drug like ibuprofen and naproxen, 500 mg, diclofenac 50 mg, and mefenamic acid 500 mg. Now, drug therapy of migraine. Mild, simple analgesics, moderate NICED combinations, and severe tripet and arcolis. And the list of the drugs you can give to the patient for the migraine. Now, anti-emetic gastrics status occurs during the migraine, which delayed absorption of the oral drug. And metoclopramide 10 mg is frequently used. Release nausea, vomiting, gastric stasis. When the patient has already vomited, it is better to give the antiemetic by injection, like domperidone and uh, prochlorperazine. Now, moderate migraine may be labeled as a moderate, where the throbbing headache is more instance of last for 60 to 20 hours, nausea, vomiting, and other features. Simple analgesics are usually not effective, but strong NSAID or the combinations maintained above are beneficial in many cases. Severe migraine. These patients suffer 2 to 3 or more attacks per month of severe throbbing headache lasting 12 to 48 years, often accompanied by vertigo, uh, vomiting, and other symptoms. Analgesic NSAIDs are their combination usually do not afford adequate relief. A specific anti-migraine drug, ergotamine, it is the most effective ergotamine alkaloid for migraine given early in attack. Relief is the often dramatic and lower dose is suffix. Dihydro orgatomine is the nearly aid effect of the ergotamine and preferred for the uh, parenteral administration because of injected DHE is less hazardous. Current status because of erratic oral absorption, uh, frequent side effects, especially nausea, vomiting, and availability of the treatments. Selective high-HT agonistics. These novel classes of anti-migraine drugs selectively activate 5-HT, 1D and 1B receptors. Now, sumatriptan, it is the first selective 5-HT 151B receptor agonistic activated other subtypes of the 5-HT1 receptors only at the very high concentration and does not interact with the 5-HT, 5-HT3, 5-HT4 to 7 alpha and beta agent. The anti-migraine activity of the sumatriptan has been ascribed to 5-HT1D and 1B receptor mediated constructions of the dilated cranial blood vessels. Now, pharmacokinesis, sumatriptan is absorbed rapidly and completely after the injections, and oral viability average only 15%. Side effects: its sumatriptan are usually mild uh, tightness in the head and the chest, feeling of the heat and other paresthesia in limb, dizziness, weakness, and short lasting but does related side effects are by the drugs. And contraindication: ischemic heart disease, hypertension, especially hepatic, and renal impairment and pregnancy are the contraindicated. Prophylaxis of migraine: regular medication to reduce the frequency severity of the attack of the recommendation for the moderate to severe migraine within when 2 to 3 or more attacks occur per month. And beta adrenergic blockers, propranolol is the most commonly used drug, reducing frequency as well as severity of attack in up to 70% patients. An effect is generally seen in the 4 weeks and it's sustained during prolonged therapy. The comparative features of the triptans you can see in the table. Now, tricyclic and antidepressants, many tricyclic compounds of the which amitriptyline 25 to 50 mg, and calcium channel blockers. Verapamil was found to reduce migraine attacks but was judged inferior to the propranolol. Anticonvulsants, valproic acid and gabapentin have some prophylactic effect in migraine. The never drug topiramate has recently been approved for migraine prophylaxis.